I'm In with the ARCC is brought to you by StoredTech, your technology, our passion. And now, here's your host for I'm In with the ARCC, Amanda Blanton.
Welcome to I'm In with the ARCC. Thanks for joining us today. I am your host, Amanda Blanton, Vice President, Marketing and Communications for the Adirondack Regional Chamber of Commerce. And today I am being joined by Erica Coletti. She's the CEO, and Brandon Barton, North Country Regional Director for Healthy Alliance. Welcome to the show, guys.
Thank you.
Hi.
How's it going?
Things are fantastic.
Awesome.
Enjoying the snow.
Yes, we're enjoying this beautiful weather. Thank you for coming. I have a lot to learn about what your organization does, so I'm happy to have you on the show. And of course, the goal is to teach our community as well, because we could have lots of listeners that could benefit from giving you guys a call or visiting your website and all the fun things. So why don't we start at the top, or the bottom, I should say. What is the mission of Healthy Alliance?
So in our country, we know that healthcare costs a lot, and we're not getting great outcomes. People are sicker than ever. And so we formed really to impact that and to have a good impact on people's health, improve it, and look upstream from medical intervention. So thinking about, somebody's not going to think about getting their mammogram if they don't have food on the table or they're struggling with housing. And so that's what we intend to do, is help to solve those with the community and other providers and help people get what they need so they can be healthy.
Okay. No, that sounds great. It sounds simple, but also complicated at the same time.
Yes. We love a challenge.
Yes, absolutely. So I understand that you are kind of operating as a social care network. Mm-hmm. I know what all those words mean individually, but what do they mean together? What is a social care network?
So we have about 200 providers, and we call them providers, but they are organizations that provide non-medical services, support services like housing, like nutrition, like transportation. We also have those in the medical community that do screening and navigation for social needs. So it's really a network of community, network of organizations in the community that are meeting people where they are.
That's really
and
incredible.
Understanding what they need.
Yeah. So as a Chamber of Commerce, we understand the importance of a network, right? Your network looks a little different than ours. We've got lawyers and accountants and all the things, but yours is really focused on the wellness of the individual.
Yes. So how do we, some people might need help finding a job or education or getting access to their primary care provider. They don't have food, or they're going to get evicted. And it's really like a very broad network of these organizations that provide all sorts of different services.
Sure. Okay.
So I don't know if you would add anything to that.
Yeah, so agencies contract with us to be able to provide these health-related social needs. The acronym is HRSN.
Okay.
And once they're contracted with us, they either are doing one part of this 1115 waiver service provision. So are they doing screening and navigation, or are they just doing the service provision of like housing, nutrition, transportation? And then once that's happening, it's really that collective network, once people are screened, is linking them up to those providers that are providing that specific service under the waiver.
Okay, so Healthy Alliance is the connector.
Yes, we're what you call the lead entity. So we're the ones who are bringing those organizations together, driving the contracting, measuring, and the data, and then the payment and billing that go on behind the scenes too.
Wow, okay. That's incredible. All right. So we talked about screening. Brandon, you mentioned a screening. This has to do with Medicaid, correct?
Yes.
Okay. So tell us a little bit about that. Somebody's curious if they are eligible. Where do they start?
So if anybody that is on Medicaid can be screened for potentially getting additional services.
Okay.
The screening is the first place to start, really, to find out. And if they screen positive, then they move on through the process of an eligibility assessment to really drill down what is their need. If they have a nutrition need, do you need food vouchers? Do you need medically tailored meals because you have a diagnosis of diabetes or another medical condition? So that's the process, but really starting with the screening is first. And there's no wrong door to get screenings. There's local agencies in the North Country that are providing screenings. Healthy Alliance also provides screenings, so you can call our office number. There's our website. There's also an opportunity for people on our website to self-screen themselves. and then that gets ingested to our agency, and then they will follow up with a live person.
And just to add on to that, we work a lot with the medical providers. So providers like Hudson Headwaters, if you go in for your primary care appointment, often you will get a screen, and you might get this screen that's asking you about, have you been hungry for, more than 12 months or had access to food?
That's usually part of
that's
the
what it is.
Yeah.
Yes.
Okay.
Yes. So that is what we mean when we say a health-related social care screening.
So I was going to ask, what does this screening look like? Because some people hear the word screening and what is happening, right? But it's just a series of questions,
it's just
essentially.
A series of basically one question that's a consent that your information can be shared, because we can't really go beyond that unless you're okay with that and comfortable with that. And then there's 12 additional questions that relate to food, housing, transportation, and safety, and some other aspects.
Okay.
But it's just 12 questions.
It's a pretty basic screening tool.
Yeah.
And people can screen themselves. It's that basic is where they can answer the questions themselves on the self-screening tool.
Okay, awesome. So let's say we get through the screening process. We have realized we are eligible. What are next steps?
Next steps, I guess, would be working with your social care navigator, wherever that person is employed, through one of our contracted agencies or ourselves. Working with that navigator to navigate you to the service that you would be eligible for.
Okay,
so
excellent.
Connecting you with local organizations that are contracted with us.
So I love this. It's very people-centric, right? Because a lot of times, if you get on the internet, you're answering questionnaires, and then you might get connected to something virtually, and it's not an actual person, and you're kind of, for lack of a better term, navigating it yourself, right?
Yes.
But here you are getting essentially assigned a person to help you through that process.
Yes.
Thank goodness.
And we have about, I want to say we have over 300 people now who are doing this navigation and management, care management in the community, not just through our organization specifically, but through our partners and others. And we really believe in that. Who's in the community will know and understand the resources much better and how to best navigate those. Absolutely. And it must be reassuring to the person on the other end, knowing that I'm working with a person to help. Yeah. It just feels better that way, right? Because you could be in a semi-crisis, right? Things aren't looking so good and you need help. The last thing you want to do is talk to a computer screen about it, right? Yes.
Or talk to somebody that is not from the area.
Sure.
I think Lions took an amazing approach because they were awarded the waiver in 3 regions, in Capital District, Central New York, and North Country, and they hired regional directors that live in those regions who deeply know and understand that. So also being able to have navigators work with a member that's from the area is also that, that's person-centered, so people know the maybe uniqueness of the North Country.
Absolutely. Yes. So speaking of regions that you serve, North Country is one of those regions. That's the one you, Brandon, are directing, if you will. What areas exactly does that cover geographically?
So we all know North Country is incredibly large.
Sure.
So it is, let's see if I can do this by memory, of 10 counties. It is Warren, Washington, Clinton, Franklin, Essex, Hamilton, Fulton, St. Lawrence, Jefferson, and Lewis.
Amazing.
Nice.
Wow.
It's about 15,000 square miles.
That's a lot. It's a
huge geographic region, but it's like the whole top of New York.
Absolutely. Yes. And it's such a diverse region too, right?
Yes,
it has
very
some,
diverse.
Small cities, suburban areas, a lot of rural areas as well. Do you find unique challenges in the North Country region compared to maybe others?
Oh, definitely.
Yeah.
I think one of the biggest ones is that sometimes there's not access to internet.
Sure.
Right?
Yeah, that's been a big
issues
topic of conversation.
So being able to do things telephonically for members can be difficult. So, and then transportation. People in rural areas, we don't have city transportation.
Right.
Up in, certain counties that are very rural.
Yeah, absolutely.
So being able to get to somebody's house and meet them literally where they're at is going to be a big part of how the North Country kind of operationalizes this.
Yeah, and I'm glad that you all are thinking about that, because it's been a conversation in this area for some time, the transportation barriers and the broadband thing. It's really incredible to me. I couldn't imagine living my life without internet, right? But there are people out there who don't have access to it 24/7, and it could be a stumbling block to getting the help and the care that they need. So,
absolutely.
Yeah, you guys thought of it all. That's amazing. And what other regions do you cover besides the North Country?
So the Capital Region and Central New York. And so it's a total of a 24-county footprint. So we go as far south as Columbia Green and then west to Syracuse.
Wow. It's a big area.
It is a big area.
Yeah.
And very, as we said, very diverse.
Yeah.
Diverse cultures and lots of places and pockets, even within one region.
Sure. So since we are in the North Country, Brandon, I don't know if you can share with us approximately how many people you guys have screened and helped out.
So total for all 3 regions, we've screened about 40,000 people.
Wow.
Out of the 600,000 that are attributed to our 3 regions.
Okay.
So there still is a lot of work to do and getting the word out there and educating people on these services.
Sure.
As far as the North Country goes, we're at about like 157,000 Medicaid lives, and we've screened almost, I think it's 11,000 the last I checked.
Okay. Do you think it's just a lack of awareness, maybe, that why you're not screening as many people as you'd love to?
I think it can be.
Yeah.
I think with a new state program, it just began January 1st, 2025.
Okay.
And there's been, updates to the manuals and, larger hospital systems and all of us trying to figure this out together.
Sure.
There's an analogy we use about like filling in the potholes while we drive.
Right.
And trying to figure out those things, but being able to provide that education to organizations for them who are working with clients to be able to provide that education to those clients and let them know about these services.
I see. So that could be a great way in, is to work with those other organizations, because they're boots on the ground, right? They're seeing and hearing things that, you couldn't possibly do all the time. So, yeah. Okay.
Now, I have to say, it was very interesting. We've been doing regional convenings, and at the last one that Brandon did, it was interesting to see how the different counties were doing. And Clinton County was blowing it away with like 15% screenings.
Wow.
And it was a lot of great dialogue about, what are you doing, or how are you doing that? So I think that's also the great opportunity, is to come together and
I've seen a lot
share.
of great movement where there's like almost between county competition and wanting to learn, like, right, if Clinton County is doing this, can we replicate that in Essex County or Washington County, Warren County, or what's Warren County doing that looks a little different here that we can replicate up in St. Lawrence County?
Absolutely.
What I've liked is that while all the counties are individual, bringing the North Country together has been amazing, and actually people working across county lines to almost develop a hub model with their organizations.
Yeah, absolutely. I love to see it. I mean, because, each county is so different. Even Warren to Washington, they're literally right next to each other, and they're so different. So, but to see counties working together and working with you, I love it. Breath of fresh air, right?
Yeah.
Awesome. Is there anything else before we get into the 1115 waiver? Anything else you want to mention about the screening process or anything?
I think just that's step one.
That's step one.
It really is step one. Get screened to see if you are eligible for the additional services.
Okay. Easy peasy.
Yep.
All right. Well, we will take a quick break, and we'll be right back on I'm In with the ARCC.
Hi, my name is David Cohen. As a project engineer at StoreTech, I focus on upgrading and improving technology that businesses rely on to be efficient and eliminate boundaries to productivity. What's different about StoreTech is the dedication to their customers and down-to-earth approach to IT. Our only agenda is to make life easier for you and your employees and allow you to focus on what's important. It's a true pleasure to be a part of StoreTech. I leave work with a real sense of pride knowing I'm part of such a wonderful team of enthusiastic people with unmatched knowledge and experience. Call us today at 518-793-1111 and see how our team can elevate your business to the next level.
And now, back to I'm In with the ARCC. Here's your host, Amanda Blanton.
And we're back. Thanks again for tuning in to I'm In with the ARCC, sponsored by StoreTech, your technology, our passion. And I'm here with Erica Coletti and Brandon Barton from Healthy Alliance. Thanks again for kind of giving us the, I don't want to say dumbed down version, but the regular person version of what you guys do. So during the break, we were talking about this 1115 waiver.
Yes.
And you guys were like, we could talk about this for hours, but we don't want to go that route, right? So in a nutshell, what the heck is it, and how does it impact your work, what you do?
Sure. So a waiver, a 1115 waiver, is something any state can apply for.
Okay.
It's applied through the Department of Health, and it's in partnership with the federal government and the Center for Medicare and Medicaid Services.
Okay.
So the state was awarded a waiver, and we were awarded these regions. But really, like, the bottom line is it's dollars that are getting invested back into the community and to support Medicaid members and to help improve their health and really lower medical costs.
Okay.
So we have the opportunity, we as the whole state, not just Healthy Alliances Network, but to use $3.9 billion to support these non-medical services for individuals. And so it's super important to get the word out. It's super important to get screened to see if you're eligible.
Sure.
Because we can say yes when there's a lot of, programs and things that can't right now. And so please reach out.
Yeah. No, this is great. So it has a lot to do with the funding piece.
Yes,
Yeah. Okay.
yes, it's very important because these services are paid for. There's, depending on eligibility, there's medically tailored meals, there's grocery stocking, there's rent utility support.
Wow, okay.
Cooking supplies. We could go on. When we say
but a lot of
housing and nutrition,
assistance.
there's a lot of assistance available.
All right. That's great to hear. So thank you for, again, giving us the version we could all understand. Because you guys did all the hard work behind the scenes to bid and get awarded. So thank you for that.
Yes,
and again, giving
excited
back.
to be here.
Yeah.
Very excited to be here.
Awesome.
This is an opportunity, too, for organizations to
Yes.
be able to bill Medicaid historically where they haven't been.
Okay.
It's really
traditionally, we have not been able to bill Medicaid for social care services, such as going to a food pantry, right? So those are usually philanthropy or grant-funded programs that money, when that runs out, that's done, right? And this is an opportunity now to expand services for that eligible population under the waiver to receive services through the waiver, which opens up the pot of grant funding and philanthropy to others that maybe would have gotten pushed out because the funds had already been used up.
I see. Okay. All right. It's really interesting. Okay. Thank you. Thank you for sharing that. Now, I want to talk about the impact that Healthy Alliance is having on people in our communities, right? Could be your neighbor, could be someone across the street, could be your kid's teacher, who knows, right? We don't know the challenges that people are going through. So do you have some stories? Obviously you don't have to mention names, but some stories of impact that you'd like to share.
Absolutely. We have a couple. I'm really excited about this. One of our success stories is a woman named Treva, actually, and she's fine with me saying her name.
Awesome.
She's located over on the western side of the Adirondacks, in our region over in Watertown. And she was unhoused, and she did not know that she was considered homeless because she was couch surfing. So she had a place to stay each night, but it wasn't hers. It wasn't her couch. And it took somebody saying to her, "You are homeless," for her to kind of understand that. She was able to reach out to some local organizations. She was able to get an apartment, get some rent paid, get that security deposit paid, getting her safely and independently housed. In that same vein, what happened was that agency was able to then hire her from some of this money that's able to be given to the organization. So they were able to hire this woman. So she had a full-time job and now is being able to help others by screening them and navigating them to services that she received in the area. And she's living independently and working now.
That's amazing. And
so
talk
there's
about
an economic impact too.
And talk about coming full circle, right? That's really incredible.
It reminds me of if you're familiar with the Maslow's hierarchy of needs, the triangle.
Yes.
Well, that bottom level is food, housing, and shelter, right? And if we don't have those things, we're not really worried about anything else.
Sure.
So for Treva, really worrying about housing, once she got that, she was able to kind of move up through those levels of that triangle.
Yes, yes.
But really, we started with the housing and addressing those social care needs. And we know that really social care is part of healthcare. And
Absolutely.
if we can address those needs, we can lower the cost of healthcare for not only Medicaid members, but everybody, which hopefully would be a lesser of a burden on the system.
Sure, definitely. I mean, you can only imagine the stress level of someone who doesn't know where their next meal might be coming from or where they're going to sleep tonight. How can they feel good about themselves and be a productive member of society, right? When they are worried about what we would consider just basic necessities and needs, but to some people, that's a luxury, right?
Absolutely.
Yes.
Yeah. Well, thank you for sharing that story. Do you have another one?
Oh, I have a couple, yeah.
Yeah.
We were actually a couple of weeks ago, before Thanksgiving, Healthy Alliance, along with some of our contracted partners up in the North Country region, were able to hand out 1,000 turkeys in Watertown
kidding.
to families. So that was a huge win. One of our organizations was able to procure 500, and another organization in the North Country matched that 500 with another 500 of their own. So we were able to hand out 1,000 turkeys.
Incredible.
The event started at 10 a.m. and people started showing up at 7:30.
Sure, I'm sure.
It was incredibly humbling to. I mean, there was a lot of. We were excited to do that, but it was emotional too to see people. I mean, in tears over getting a turkey.
Yeah.
So they had a holiday to be able to have some food.
Absolutely. And food insecurity is a growing need, I feel, especially in the North Country, for various reasons, right? But I can only imagine how emotional that was, but impactful as well.
Yeah, absolutely. It was fantastic.
Yeah.
And one of the things that we are seeing in the data is that nutrition is the highest screen need.
Sure.
And I think, again, the value of this waiver is amplified by there's a lot of data collection going on too, and bringing visibility to these needs in a different way than I think the state or any organization has been able to do in the past.
Right. If you have another story, I'd love to hear, but I have a quick question because this is how my brain works. Now the gears are turning. You're talking about Medicaid, eligible people. Where do children fall in this? Are they eligible for your services?
Yes.
Yeah, thank you for asking.
Yes.
Yeah.
Children are
Absolutely.
eligible for services. I actually am going to be meeting with some of the local school districts in the coming weeks just to kind of get this information in front of them because we know the social workers or the teachers in school are going to know those kids that maybe are struggling with food or other issues that these services could potentially help with.
Yeah, I remember, it was years ago that I learned about how great the need was, for free meal plans in schools, that, children are being sent to school without a breakfast, without a lunch. Maybe they didn't eat dinner the night before. It's really, unfortunately, awful. But, it's a reality that we're facing. So I just wanted to make sure we made that clear that children are eligible as well. So,
absolutely.
Okay.
And what New York State and the federal government did well in this too is they looked at the household.
Okay.
So if a child is eligible and needs food, it's not just that child that will be, that you have to look at the whole
the
family.
household,
Right.
Yeah.
So they look at it more broadly.
Absolutely. Okay. Well, thank you for clarifying that. Just wanted to make sure our listeners understood that as well. I'm willing to hear another success story if you have one.
We have another one. Yeah, there was this young mother actually, and she worked with a local agency in the Capital District. She was facing eviction. She was a young mom, and she worked with a local organization to. She was screened and navigated, and they were able to pay 6 months rent for her.
Wow.
So she was able to remain in that house with her children. That agency then helped work with her on budgeting, helping her find a job so that she could continue to pay rent. But that was really the buffer for her and a godsend almost, like that 6 months of her rent was able to be paid while she focused on saving and learning those kind of skills through this organization that's contracted with us.
That's incredible. And I love to hear stories like this because it's more than just putting a Band-Aid on something. It's let's teach these individuals the skills that they need to now do their best, right? And moving forward. And they may need help again, but, we can provide them those skills and resources. So
this is our opportunity to show that social care works. And that we know this works and that it helps people.
Absolutely. These stories alone, and I'm sure there's hundreds of stories, right, that you could potentially share. We don't have time for it, but I'd love to hear them. But, but yeah.
No, and broadly, at a higher level, you hear all about ED wait times and, this will bring those down. This
Gotcha.
will lessen that burden on the health systems too that are really trying to keep up with, what's in front of them as well. So
It's a ripple effect, right?
Yes.
It doesn't just impact that individual or family. It really impacts the economy, the ecosystem, the community that they live in and beyond. So, wow. Great work, guys.
We're very passionate.
Yes,
very excited about this opportunity.
I love it. Well, as we round out the show, is there anything else, anything we missed? But there's a lot of information out there, right? And the best way, I think, is to visit your website or give you guys a call or shoot an email. So how can we get in touch?
You can visit our website at www.healthyalliance.org. You can email us at info@healthyalliance.org. You can also call us to get screened at 518-379-0233. Or you can find us on Facebook, Instagram, or LinkedIn.
Excellent. So lots of opportunity there to get in touch. And, just ask the question too, right? If you don't know, just
absolutely.
Just ask the question. So awesome. Well, Brandon, Erica, thank you so much for the opportunity to learn more about what your amazing organization is doing. The impact, again, it's a ripple effect. So we love to see it. Even if we're not experiencing it ourselves, it could be our neighbors. And I hope more people give you a call.
We appreciate it. Thank you.
Yes, you're so welcome. And that's all the time we have for today on I'm In with the ARCC. Be sure to tune in next week.